Good afternoon, everyone. Thank you so much for joining today's learning session on getting the most out of your virtual visits. We will begin the presentation in a couple of minutes, so please stay tuned and let us know if you need anything through the chat box. Just want to give it another minute or so for a few more people to join. Okay, let's go ahead and get started. Thank you again for joining today's webinar presented by the Foundation for Peripheral Neuropathy. We are looking forward to a robust session and appreciate you joining us today. Before we begin, I'd like to take a couple of minutes to highlight a few important items. This presentation is being recorded and a link will be sent out to you in the next day or two. The recording will also be uploaded to the Foundation for Peripheral Neuropathy's website. I do encourage you to use the chat box located on this webinar platform to ask any questions, whether it be about resolving a technical issue with your session or about the content that's being presented. Please do keep questions on topic and we will try our best to answer them at the end of the presentation during our Q&A session. If you are having problems with the audio on your computer or device, I encourage you to please dial in by telephone. The dial-in instructions can be found in the emails that have gone out to you in recent days, and there was even one email that just went out about an hour ago. Lastly, we're going to launch a couple of interactive polls during the session, and we want you to participate in them. In order to participate, you need to minimize the viewing of this presentation. You may already be there, but if you are in full screen mode right now, and when we launch the polls, please press the escape button on your keyboard to minimize the screen so that you can vote in the polls. I do apologize for this inconvenience as this platform is having some minor technical difficulties at the moment. It's being addressed by our friends at GoToWebinar, and we're hoping that this should be resolved by the next time we host a webinar. And again, before we get started, just wanted to quickly introduce myself to you. I am Lindsay Colbert. I'm the Executive Director of the Foundation for Peripheral Neuropathy, and I'm joined today by my colleague Tanya Zivin, who will be assisting any questions that you might have throughout the webinar related to technical difficulties, for example. And I'm now pleased to introduce our guest speaker, Dr. Shanna Patterson of Mount Sinai in New York. We're lucky to have Dr. Patterson as the Foundation's Patient Education Advisor, and for those of you who attended our last webinar in March, you know her well. She has offered to co-host today's session on getting the most out of virtual visits with your doctor. Dr. Patterson, welcome. And at this time, I'll hand the microphone over to you to get us started on the session.
Thank you so much, Lindsay, and thank you so much to the Foundation. I really appreciate the opportunity to be able to speak to everyone, and hopefully this will be an enjoyable and helpful session. You know, we actually had come up with a number of different topics that we thought would be of interest to this group late last year. And of course, 2020 for many of us has not been the year, for any of us, has not been the year that we anticipated. And so we wanted to really respond to that and think about what might be some topics that have come to the forefront or questions with respect to your medical care for neuropathy that might be coming up for you as a result of the pandemic. And one of the things that we've seen proliferate is, of course, the use of telemedicine or teleneurology for medical care for those who are unable to go to doctor's offices or when provider offices are closed. So I wanted to think about that and be able to talk together about different ways that we can make sure that your care is progressing as smoothly as possible, and how you can prepare for these visits, how you can collaborate with your providers, and even what is telemedicine and where do we expect it to go in the future, even after the pandemic ends, based on what we've seen so far. But before we really get started, I also wanted to just take a moment, especially during these extraordinary and challenging times, to say thank you to everyone for joining us. I know that these last few months for many have not been easy, and I'm very grateful for to be able to participate with the foundation and to be able to be a part of such a wonderful community. I think that the ways that we can support each other through these times will be very helpful, and I look forward to continuing to partner closely. So as we begin, I'm sure that many of you who've joined either may have had experiences already with telemedicine, or some people call them video visits with their providers. And that maybe that is that type of an experience, or you're thinking about having that experience has led you to join us here today. So what I wanted to start off with is a kickoff survey question, which is how many people have used telemedicine or video visits for any type of medical care so far? And there are just two simple answers. One is yes, that you've tried it before, or no, that you've never tried a video visit or telemedicine experience previously.
And this is just a reminder, if you cannot see the poll right now, you need to press the escape button on your keyboard to minimize your screen, and then the poll should pop up. I apologize again.
All right, let's take a look and see what kind of results we have. So this is an interesting kind of sign of the times that the majority of people on the call have tried using telemedicine or video visits for any type of medical care so far. So 59% of respondents have tried it and 41% have not. I think that we've certainly seen, even among medical professionals, a humongous increase in the number of medical professionals who are providing it. I know at our institution or in our department, we had a relatively small number who were using it before the pandemic, and some additional others who were thinking about incorporating it into their practice. And now every provider is using it with very few exceptions. So this is a revolution, if you will, I think, in the way we take care of patients. Let's go back to the presentation. And we have one more kickoff survey question. So for those of you who have had the telemedicine or video visit already, which was, as we saw, the majority of people here with us, what was your general impression of the experience? The first option is positive. You found it to be effective and convenient. The next option is you're not sure, you have some mixed feelings about it. And the last option is negative and you wouldn't want to do it again. All right, let's pivot back and take a look and see what the responses are. So this is great. This is really interesting. So we have a response that 53% of people who responded said that they had a positive experience. 45 weren't sure, some mixed feelings, but even though that's somewhat ambivalent, only 2% responded that they had a negative experience and wouldn't want to do it again. I have to say that I think it's so interesting to hear your perspective, because I know that a number of colleagues, even over the last month or two, have also been describing their experiences. And many neurologists really are old fashioned, or we think of ourselves as old fashioned, and we really value seeing patients in person, and thought that we would never be happy or satisfied seeing patients through video visits. And now I think many of us recognize that it has more possibilities than we previously thought, but many of us have, certainly, um, the sense that there's definitely a need to still see, patients in person, at least for some of the time. So this is really interesting. Thank you all so much for sharing. Let's go back to the presentation. And I hope, it'll be interesting. It'll be that, to see that some of the points that we're about to discuss here, maybe for those of you who had some mixed experiences or negative experiences, that hopefully this discussion will help give you some tools that you can use to improve your experience in the future. Even though many of us, pretty much, who doesn't wish that things, were the way they used to be, and that we could go back to life as it were before the pandemic. But I think given that we're in a new reality, or new normal, as people describe our current status, I think that, we have to kind of make the best of the situation. So hopefully this will be helpful. The first thing that I want to discuss is really the concept, just to back up, of what is telemedicine. So many people are used to perhaps having, phone calls or exchanging written messages with their providers for, many years now. The one of the distinctive features about telemedicine is that it is a synchronous exchange with remote care, usually video, and video offers many advantages over just a telephone call. But the idea being is this is not an asynchronous exchange where you're sending a written message and you get a reply later. You're having the exchange in real time. Um, these are telemedicine is really executed through a variety of HIPAA compliant platforms. So many times when you're logging in for a video visit, you may be logging in to a portal that links to your electronic medical record system. But all of these are HIPAA compliant platforms, so there's privacy insured. And also these are visits covered by insurance. So in many ways, the new kind of way that these visits are covered is the same as if you were coming in person. And I think one of the things, to the credit of Medicare, Medicaid, and insurance companies, is that there was a broad sort of realization at the beginning of the pandemic that they needed to be able to accommodate this. And so fortunately, many providers very rapidly changed their policies um, to ensure that patients would be able to get the care they needed using insurance through virtual care during the pandemic. And we don't know what the future holds, but we anticipate that this will remain similar as it is now. So let's focus in. Of course, we're talking about neuropathy on these discussions. I'd like to focus in on how telemedicine can help people with neuropathy specifically. So I think that there's some pluses and minuses, to be honest. I think that, and I've been doing a number of video visits throughout the pandemic and even today. I think that telemedicine for neuropathy patients is excellent for discussing medical history. Some of the things I've noticed is, I think for some patients, they appear to be really kind of relaxed. They're at home, maybe they have a cup of coffee. It's kind of a, easier situation than perhaps just having to have found parking or traveled, or rushed to a visit. So I do appreciate the fact that I think in some cases, clearly patients are in a comfortable space and they're relaxed. and we can just kind of dig right in and get to know each other and talk about their medical care. One ironic thing I didn't include as a bullet point, but I've definitely noticed since we've recently reopened our medical offices here to in-person care, is that even though in person you can certainly accomplish a lot more and there's a sense of intimacy being together in person, it is strange because we're wearing masks. And so the only time now where I get to see my patient's face and they get to see my face is through a video visit. So it's kind of a little bit of an irony, a twist on the intimacy or not of being in person versus a video visit. I do think that telemedicine is a great way for neuropathy patients to engage with their providers to troubleshoot and fine-tune symptom management. So if you have, for example, neuropathic pain and you're taking different medications and you feel like one of them is working or not working, or what did you do yesterday, or what should the plan be, and so forth, this is a great and convenient way to go over those issues and to come up with a plan together. And as many, I think as everyone's experiencing at this point, prescriptions and orders and so forth can be placed electronically, and so it's really seamless, and then you just have to coordinate getting the prescription afterwards if needed. And another thing that I think is really interesting is that video visits now are potentially an easy, and especially in the era of the coronavirus, a safe way to include family members in your discussions. So I don't know if any of you have gone for many in-person patient care visits recently, but I think that at least our experience here is that we're very much restricting the number of people who can come with a patient unless it's absolutely necessary. So in the past, when maybe friends or spouses would accompany patients for support and to provide additional information, now we really have to limit sort of our space to the minimum number of people. And in many cases, it's not possible. Certainly, we can call people on the phone during the visit. Whereas during a video visit, if you happen to be home with your spouse or your significant other or friend, and you'd like for them to join in the conversation, it's an easy way to do that. And there are even ways to actually have the equivalent of sort of a three-way call during the video visit where you can actually bring someone else in so they can participate in the conversation, whether that's a different provider or a different family member. Certainly, telemedicine and teleneurology is convenient, especially if traveling is burdensome or risky. It is a good choice, I think, for follow-up visits, and it can potentially help triage the need for an in-person visit for certain situations. Also, one thing I think that is interesting now is that more patients than ever are engaging with different types of technology out of necessity. And so I think that patients are actually, I've noticed, are more able to take advantage of other online resources or portals to access their medical records that were always there before, but that just maybe seemed a little less, there was a little less urgency, or it was a little more inconvenient to figure out how to get to them. I've noticed that now more patients are writing me messages through their online portals, through their records, so we can stay in touch more frequently. That did exist before, but I think because people are now using these online tools more, people are quickly becoming more comfortable than in the past. Certainly, using different online portals is an easy way to request refills for medications, and also for many electronic medical record systems to check testing results or even review your entire chart, including notes in some cases. So what are the limitations of telemedicine for neuropathy patients? Based on what we've seen so far and among discussions within our division and some of the early literature that's coming out from different medical professional societies, it is obvious that as much of a physical exam as you can do, you can't do all of the elements of a physical exam for a telemedicine visit. And so for certain things like detailed reflex testing or sensory testing, it is challenging to impossible to do it through telemedicine. We have been surprised, and pleasantly so, at how much you can accomplish, and especially when the patient is able to partner with you. So I will get into that actually a little bit later. Another limitation, of course, is that it's really not possible to officially diagnose neuropathy through a video visit. So we can talk, and if your symptoms sound suspicious for neuropathy, that certainly is progress. But in order to really formally diagnose neuropathy, you really do need the comprehensive physical exam, oftentimes testing such as an EMG test, and these really do require an in-person visit. However, once you have that diagnosis, again, if you're doing different types of follow-ups that are more or less routine, certainly that can be done pretty well through telemedicine. And I think that, during the height of the pandemic, when we weren't able to see anybody or very, very few people in person, except under cases of emergencies, there's no doubt that telemedicine was an improvement over the alternative. And it certainly allowed us to see people and reach out to people, even if it was to make kind of a temporary plan until we were able to resume seeing people in person. And I will say, this is a limitation for all patients, is that sometimes the technology can be challenging or the Wi-Fi doesn't work well, and it gets in the way of the visit. I think that as more and more people are using this technology, my hope is that the different platforms will respond to glitches and that the workflow and the patient experience will improve with time. But of course, we'll have to wait and see. So I've been thinking about this a lot lately as I've been meeting with a variety of patients through video visits, and I've noticed that there certainly are certain different circumstances or things that I think allow patients to get the most out of their virtual visit. So I wanted to talk about those. The first thing, of course, is if at all possible, think about the setting where you're going to be during your virtual visit. I've had most patients, I think, are at home in a comfortable space that's quiet. I've had patients in their cars not driving, but in their cars having video visits or walking in the park having video visits, which is like sounds like a futuristic state, but here we are. But it is really optimal, I think, if you can find a quiet space where you will have a good internet connection, assuming you're using Wi-Fi, there won't, that your audio will be clear and that you have space to move around so that you're not kind of tucked back in a tight corner, for example, sitting at a table. And I'll talk more about why I think that's important in a minute. You will often receive instructions from the office on how to log in for your video visit, so it's helpful to practice or to reach out to them if you have any questions in advance. And just like this is the same with an in-person visit. If there's any issues or concerns that have been on your mind, making a list and having it with you at the time of your visit can be really important. If you're using your phone for the video visit and you made notes on your phone, of course, trying to make sure that you have that information on a separate piece of paper or on a separate screen is helpful. And when it comes to the physical exam or the virtual physical exam, this is an enigma, and many neurologists felt very uncomfortable with this, but we've been able for neuropathy patients to come up with ways and to partner with different patients to actually get a fair amount of information, although it's certainly not as good as being in person. Again, with respect to where you are, think about setting your stage also for the physical exam part of the visit. So have space to move, not being kind of closed in an area that's hard for you to be able to get out, or maybe if you're in a public setting, it's maybe awkward if you start taking off your shoes and so forth and socks. So I think ideally a space where you can sit down comfortably for the discussion, but then where you're able to kind of freely move your arms and legs, maybe redirecting the screen so that the physician can see your arms and legs in different positions. And if you have space to walk, that is actually ideal so that you can orient the phone or the screen so that they can watch you walk a little bit, which is an important part of the examination. Be prepared to remove your socks and shoes, especially for patients with neuropathy. This is important. And even if you might think, well, what does it matter sort of what my feet look like? A lot of times it can be really helpful for the neurologist to be able to inspect the skin, in fact, inspect the feet, and also have you, make certain types of subtle movements that can give a clue as to what the strength is like. In terms of strength testing, though, usually we're pushing and pulling against different muscle groups when we see patients in the office. And that really kind of gives us a good sense of, how strong somebody is. Clearly, there's limitations with that unless you have a family member who's going to kind of, participate and, sort of perform the examination on you. But I haven't actually seen that yet. One thing, certain things that you can do, it are things that use your body weight. So for example, standing up from a chair without using your arms, standing or walking on your toes or your heels, standing on one leg at a time, or squatting, without bracing yourself with your arms. These are all things that give indications about leg strength, or foot, muscle strength, that you can essentially kind of demonstrate whether they're strong or they're weak, without having to interact with another person directly. If you have an object, if you have, especially if you have weakness, I think if you have an object that you've noticed that is hard for you to lift, that normally was easier for you to lift, either describing that, so that's kind of a helpful metric for the provider to know about, or if you have something that's easy, like I've noticed, I have trouble grasping a can of soup or something along those lines, you can maybe have a can of soup handy so you can show what happens when you try to grasp it. In terms of the sensation portion of the physical exam, which is so critical for many neuropathy patients, there's a few things that you can do on your own. So first of all, if there's an area that you notice where you're having a lot of numbness or tingling, even just being ready to kind of indicate, with your bare feet and indicate with your finger what that area is like can be helpful. You can even potentially bring like a tissue or cotton ball and rub it over different parts of your foot or your lower leg and show the doctor, I feel it here, or I don't feel it as much here. And that really maps out for them some of the things that they would be doing with you in person, to give them a sense of what the problem is and what parts of your body are involved. There's um, there's an image here to the right called the Romberg test. And Romberg was a famous neurologist, and this test is really a balance test, but it's a balance test that shows us how sensitive a person's feet are. The idea is this, and many of you have probably done this with your doctors in the past. The idea is that when we stand with our feet apart, we kind of give ourselves a wider stance and more, and we're more stable. It's harder to knock us over if our feet are spread farther apart. And that's why, amongst other reasons, if people are, for example, on a train or an airplane and there's turbulence, people tend to widen their stance to kind of stabilize themselves. So by contrast, if you stand with your feet close together or touching, that kind of puts you at more risk of being a little bit unstable. And what we all intuitively do without even thinking about it is that we use other senses, our vision, the sensation, the physical sensation of the ground beneath our feet, the sensation of the position of our different muscle groups in our body. And that helps us to stabilize ourselves and keep ourselves upright in a very sort of automatic way. We don't even think about it. And you can even close your eyes like this, taking away vision, which is a big help being able to look around. You can usually close your eyes, and under normal circumstances, individuals will still be able to rely on a really close sensation of what the ground is underneath their feet and make small adjustments so that they don't fall over or they don't even wobble. In a patient with neuropathy, however, you may feel very unsteady when you stand with your feet close together, and you may become even more unsteady or potentially start to fall over if you close your eyes. So I certainly do not, this is something that if you're feeling like you're off balance and you're participating in a video visit with your provider and you want to show them what your balance is like or what the problems with your balance are like, you can actually go ahead and demonstrate this and position your phone or your computer so that they can see you standing with your feet closer together, and then show them if you are stable or at what point if you start to feel unsteady or start to sway a little bit. I certainly never ever would encourage a patient to do something that might actually make them fall potentially. So I think, if you feel markedly unsteady anyway, don't do this. But if it's something that's subtle that you want to show how this comes about, this may be an interesting maneuver to demonstrate to your doctor on a video visit. During many in-person neurological evaluations, this is part of the neurological exam, and you may have already done this with your provider there with you in person, as in the image. Walking is also an important part of the physical examination, and different types of neuropathy can impact walking in different ways. It's a little more instructive to be able to see you walk potentially without shoes on, if possible, because that allows the provider to see, sort of what your feet are doing in more detail. So again, when you're choosing your space for your video visit, if you can find a location where you can position yourself and the device so that you can show the provider how you walk over a short distance, that can also be very helpful. And then when people think about, to kind of look toward the future, well, this is something that we've seen kind of really balloon in many ways since the pandemic, but is teleneurology here to stay? So what's interesting is that, the short answer I think is absolutely, but the trajectory of how we use technology in medical care is certainly changed dramatically over the last several months. If you actually look at teleneurology or the utilization of video visits for patient care, this used to be primarily focused on emergency rooms or hospitals, and especially for areas where there wasn't a neurologist available in the hospital, but sort of emergency or urgent level of care was required. Now, and that's been actually going on for several decades. However, this has really, I think, provided an opportunity for many, many people to use this as a matter of routine for outpatient care of many sorts. And these are a couple articles that have been recently written. Interestingly, um, the neurology article on the right was published before we really saw the rapid escalation of the pandemic in the United States. So I think it's It just happens to be interesting. This has really been a hot topic in the field, but it was more along the lines of people advocating for it and some people trying it, but a lot of providers saying this is really something that we have to embrace, and this is kind of the future. And now I think we all say, the future is really now. The article on the left was published in a journal called Muscle and Nerve, which is really one of the preeminent um, medical journals for providers in the neuromuscular field, which includes neuropathy. And this kind of just shows you how detailed the academic approach to using this technology for specific types of disorders is. So this was an article that was first published in March of 2018, called Telehealth Applications for Outpatients with Neuromuscular or Musculoskeletal Disorders. And neuropathy falls into a neuromuscular disorder category. So this was actually in the midst of the pandemic surge. Actually, this journal compiled an electronic or digital issue, if you will, where they compiled all of the articles that they had published in the last few years related to treating patients this way, and then made them, sort of free open access for all of the doctors who were learning how to do this over the last several months, which I thought was great. So I think, again, we've had a history that's longer at this point than you might think for this type of technology. But now and prior to the pandemic, we really were in a mode where there was kind of a more methodical, gradual expansion. But I do think that now this is something that's being broadly utilized. And, we will see sort of what the future holds as we go along. But I've definitely spoken to a number of patients who've said, this is really great. I, feel like if we just have to catch up about some issues, I would be very happy to continue doing this even after the pandemic. I've had a few patients who've said, they absolutely prefer to come in person. And I think that a lot of providers feel like this can be an excellent tool for some patients or for all patients some of the time, but that, certainly, especially with respect to neuropathy, there are certain situations, and I would say those situations include making the initial diagnosis of neuropathy, or if there is a significant change for the worse, meaning some new or worsening weakness or sensory problems where you really need to be evaluated in person as well. So at this point, what I would like to do is really to acknowledge, again, the foundation for offering this opportunity for us to not only have these webinars, but also the agility and flexibility to kind of pivot at short notice to include different topics in response to the things that we've been experiencing. And I want to really acknowledge all of you for joining and taking this time. I really appreciate it. I hope that the content has been of value. And I think, now more than ever, it's always really important to think about ways we can take care of ourselves. So hopefully some of the information here will help you all take care of yourselves, not only now, but into the future. What I would love to do is to spend some time answering questions and just hearing a little bit about what's on your minds and what we can discuss in the time remaining.
Yeah, Dr. Patterson, thank you so much. So we did get a couple of questions that came in while you were speaking. And the first one that I thought would be great to be addressed is as follows. A patient is going to have a video visit with his neurologist to assess his gait. And what would you say is the best way to get the most from this visit?
So that's a great question. I think that some of the things that we discussed, including how you're setting up where you're going to be for the video visit, is a really important consideration. So making sure that wherever you are, you can be comfortably seated for the part of the visit where you'll be having a conversation, but that you have a good amount of space so that you can get up and walk with the camera or the computer facing you so that they'll be able to see you walk. And depending on what the specific problem is, I think that for most providers, it's really helpful to be able, at least for some of the time, to be able to see what your whole body, the mechanics of your entire body are like when you're walking, and also to be able to have a vantage point where they can potentially focus in on your feet. Um, Being ready again to take off your socks and shoes is important. I think that for many individuals, if there's no problem with walking, this isn't as critical, but if there is, it can be helpful to see what the dynamics are of the foot movements with each step. So being ready to have be in a space where you can walk barefoot. Different types of maneuvers with walking that you've probably experienced in doctor's visits, potentially or neurologist visits already, are things like walking on your toes, walking on your heels, or even sort of walking, putting one heel or one toe kind of in front of the other, like you're walking on a tightrope. These are sometimes things that your provider might ask you to do, or if you're doing them or you notice you have trouble doing them, you might want to offer, on your own to say, I'd like to show you what it's like now when I walk on my toes or walk on my heels. Making sure that, again, that the space is well lit can be helpful. Sometimes I've noticed patients' homes and even like just when you turn the camera a different direction, it sometimes automatically adjusts the lighting and then it appears very dark and kind of shadowed. So try to make sure that the way the lighting is set up is such that the provider will be able to see you well while you're walking. And these are some of the things that I would say are important. And if you notice, lastly, that your walking is a problem because of balance, using some of the tools that I described when we talked about the Romberg test and trying to see if you can do anything that demonstrates to your doctor during the video visit, aha, look, this is when I feel off balance while I'm doing this. That can also be extremely helpful.
Great. Thank you, Dr. Patterson. The next question that I had, sorry, I'm actually trying to find it. So you had mentioned that obviously it's hard to get a diagnosis through a remote session, but what really is done after the diagnosis of neuropathy has been made specifically in this avenue of virtual visits?
Absolutely. So it somewhat depends on the patient's neuropathy, but I've been seeing a number of follow-up patients for this, and I can certainly give some examples from my personal experience. So let's say that the diagnosis of neuropathy has been made, and it really depends on your symptoms. If you have no pain and no imbalance and minimal symptoms, it may very well be that you know you need just periodic follow-ups or annual follow-ups just to monitor and make sure that nothing's changing, and those could potentially be done over video visits, but it usually would be good at some point to be seen in person for a physical exam. For many patients, I think, who have problems that are similar to pain, which is not uncommon in neuropathy, video visits can be very helpful. So it can really allow us a much more intimate forum compared to just a phone call. And it can, as we've discussed, facilitate some degree of a physical exam where we can stop and say, okay, where is the pain? Show me, and I've had patients where they kind of trace around the areas of their feet that are most bothersome. Show me, what happens when you're walking, these sort of things. And then they can go ahead and we can talk about their symptoms, talk about what medications they've had. One thing that I love is that occasionally when we see patients in the office and we want to clarify which which pills are you taking or how many are you taking, and they have maybe the names or I have the names but they're not quite sure. This is actually very convenient because when you're already at home, patients can literally go and grab the bottles in the other room and say, aha, this is the one that I'm taking 2 times a day, or this one I actually am a little bit low on, or whatever the case is. So that can actually be very helpful. um, I think that, sort of doing routine check-ins about symptoms is very helpful for a video visit format. Also, if you did have a visit where you had some testing done, maybe some blood tests were sent to evaluate for possible underlying causes of neuropathy, then these visits are also great ways to review those results, to kind of talk about getting copies of the results if you don't have them already, explaining what the results mean. Usually the provider has a way to send you through a portal different additional educational materials or website links that you can so you can answer any other questions you may have.
Great. The next question that just came in is surrounding the topic of security. As you can appreciate, there are obviously some technical breaches and security and problems with platforms, including Zoom. So, this patient is curious, how confident is the medical community in ensuring that patients' most intimate life details are just being shared with the patient and provider?
So that is a really, really fantastic question, and I know that that has been with everyone suddenly doing everything over Zoom or other platforms. It's really become very, very important. So we did have very close guidance, especially toward the beginning of the pandemic when so many things were happening so quickly, very close guidance about this very issue. There is no doubt that certain platforms are very secure and others not as secure as really they should be to provide patient care with utmost confidence, like Zoom, for example. So the way that we approached it is this. We really limit the number of platforms in our institution that we use with patients. We really focus on using the platform through our own secure electronic medical record, which is called Epic. So patients will access their video visit, in this case, by logging into their patient portal called MyChart, which is essentially linked securely to the electronic medical record system, to their electronic medical record, and they have to get a special passcode to even set up an account for it. And this is the way that we engage. And the doctor then also logs in through the same portal and then does documentation in the chart during the visit. So this is very secure. We did have some exceptions, especially early on as things were happening so rapidly, where we had to come to an agreement at the time whereby if there was a patient who was having an emergency, and we knew, especially being in New York City, that at a certain time in the past, it was not safe. We really didn't want people to go out in public unless they absolutely had to. So if there was a patient who we really needed to see on in a video context and a phone call wasn't enough, but they didn't have access to our MyChart or Epic technology, in emergency kind of circumstances to potentially, protect the patient from undue risk of coronavirus, we would sometimes then say, okay, we can potentially use Zoom or another one of these mechanisms, if under kind of urgent circumstances.
Very good. Thank you. Another question. Are neurologists developing any tele-instruments for neuropathy? Because this patient has seen tele-instruments for heart patients, for example.
So I think, if I'm I've seen some of these things as well. So I'm going to, I think what we're driving at here are kind of is using technology remotely to monitor patients' medical conditions. And I've definitely seen applications of that in neurology, but there's not something that's specific that we can monitor so far for neuropathy. So just to flesh this out a little bit more, I think many people may have been previously familiar with heart rate monitoring, where you can have essentially almost like a few leads or stickers on, as if you were having an EKG done to look at your heart rhythm. And some patients where there's a concern for needing to detect an EKG will have a device either implanted or they'll wear it, sort of around their body and go about their business for a day or 2 days or longer. And somebody remotely is logging in and monitoring their heart rate for any signs of any rhythm dysfunction. Similarly, there are and have been certain types of remote monitoring for neurology in the past, looking at EEG, which are, brain waves, usually tests that seizure patients have, where patients can do the same thing where they can go home, wear some electrodes, and then come back. Although usually the technology is such that you don't know what the results are until the patient comes back, and then you take sort of the computer device and upload it. So you don't really know what's happening in real time. We do have now, I think, an expanded interest, especially because of the pandemic, in remote monitoring of patients for things like blood pressure or blood oxygenation and pulse. This can be more important in neurology in certain types of stroke patients. So let's say, for example, there's a patient with a stroke, and following their stroke, it's very important for them to have normal blood pressure and so forth, and medications should be adjusted if their blood pressure is too high. So I think that, to a certain extent, even prior to the pandemic, but it was really accelerated during the pandemic and also used for patients with COVID. These devices that can also measure, especially for the COVID patients, the level of oxygen in their blood. Patients would have these devices, check their blood pressure or their blood oxygenation at home regularly, and the data would automatically be transmitted to a secure, essentially a cloud-based location where it would be logged and monitored by certain people from a medical team to make sure that for each patient, they were within a safe range for those parameters, whether it was a safe range for what their blood pressure should be or a safe range for patients, of course, with COVID of what their blood oxygenation should be. And then if there was an issue where it was abnormal, that would actually automatically trigger a video visit where they would call or arrange a video visit to say, okay, what's been happening? Do we need to adjust medications? Do you need to come in person and so forth? So this has been really exciting. And I think we're going to see more applications of this going forward. But with respect to neuropathy, it's tricky because there's really, there's really not a good sort of technology to look at, and either really there's not a great need for to look at on a day by day basis, sort of what your nerve conduction velocities are, for example, or what your EMG looks like. So we don't really have a way to look at sort of biological, physiological data with respect to neuropathy remotely. Um, but who knows, maybe at some point we will. I do think in other areas of neurology more related again to the stroke arena, I think that we're seeing the expansion of some of these sort of biometric kind of monitoring, remote monitoring, to provide real-time patient care, especially for patients who are potential, who are, there's a concern where they might become sicker, or they might need a quick intervention.
Great. We have time just for a couple more questions. This is actually a question that came in response to one of your other answers regarding my chart. Do you know offhand, Dr. Patterson, do all institutions around the US or even abroad use my chart? And secondarily, do those departments or institutions help provide directions to patients to get set up with that?
Sure, that's a great question. So it's a little bit like electronic medical record systems are a little bit like cars, insofar as there's different brands, but according to a law that was passed, we're coming up on about a decade ago now, all practices are required at this point to utilize some sort of electronic medical record system, meaning they shouldn't have like just a paper chart only. So things should be based in the computer. This is of course helpful now because a lot of these electronic medical record systems incorporate over time different functionalities that, for example, allow for video visits and so forth. I don't, the one that we use that has what I was describing as my chart is called Epic. The name of the electronic medical record health system is called Epic, and many larger institutions use this one. But there are a variety of different types of electronic medical record brands out there that different groups or institutions use. And there are also a variety of different types of HIPAA compliant platforms that have been developed to facilitate patient video visits, including some, I think, through Doximity, which is a sort of a physician oriented resource website, and other platforms. So it's possible that depending on the system that your doctor is in or is using, it might be a technology that's linked with your entire chart, like it is for Epic, or it might be a separate kind of web-based portal that you're using just for the video visit, but it's not actually attached to the rest of your electronic medical record portal. And so I think that it really just depends on where your doctor is, but um, the resources that will be attached to it will depend a little bit on what system they use. And I would say, just to answer the last part, I really I really do think, I know we've been having a lot of messaging to our staff to really prepare patients for video visits, by sending out instructions, making sure they understand how to log on. And if we notice that they don't seem to be logging on, we make sure that somebody gives them a call right away, just to make sure, is everything going okay? Are you having trouble? I would expect that pretty much that's been, the norm across all practices to help patients with this.
Yeah, me too. All right. And the last question that I'll ask of you on behalf of a patient for today's session is, what would you recommend to help patients with telemedicine visits like this that don't have access to a computer or a camera, just a phone? How can they really get the most out of it, knowing that they can't, take a cotton ball and push it on their feet to show something? What would you say to someone that has those types of limitations?
That's a great question. Thank you for asking that. So, I think it is interesting because in a lot of ways, and we've a number of us have rallied, together about this, saying that yes, it's true that, we think that many patients are able to use a camera on their computer or on their phone and engage in these video visits, but there is no doubt that that is not the case for everyone. And we cannot sort of, we have to be sure that we can provide care to all patients and provide some degree of offer services remotely for all patients. So this is certainly a point of discussion in the medical community, be rest assured. We do telephone visits. So in those cases, what we do is we offer to schedule a phone call, and I think that there's a convenience to this because, like a regular visit, it's a scheduled time. So you can be sure, that you're free, and then there's a scheduled, like, set amount of time. So you can actually have a long, conversation with your physician for who knows, 20 minutes or a half hour, whatever the time is that you would normally be talking during a regular visit. And I think that this is helpful as even as opposed to maybe, calling your doctor for a quick question or advice in the past, where I know I personally sometimes we get caught up, unfortunately, in playing phone tag, or you call them and they're like, oh, I'm running to catch a bus or something, and it's loud and it's not a great time to talk. This is actually really distinctive and really nice, because you know that everyone's kind of planned this time for this purpose, and you can have some meaningful conversations. There certainly are limitations because of the lack of visual element, and it is what it is. So certainly I would say if you are preparing for a telephone visit, it can be useful to think about some of the things we talked about during the physical exam portion. And maybe if you can notice some of those things on your own and describe them to your provider, that can actually be very helpful and allow them to kind of anticipate what your physical exam is like. So you can say, I was trying to walk on my toes, for example, and I noticed that I wasn't able to really, you know, walk for more than a few steps before it felt like it was an effort to stay up on my toes. Or, I stood with my feet, touching each other close together, and then I started to close my eyes and I felt really off balance. And that's kind of what I've been experiencing recently. So I think even just practicing a few of these things on your own so that you can describe what happened can be very helpful in bridging that gap for the physical exam piece.
Great. Thank you so much, Dr. Patterson. I know here at the Foundation for Peripheral Neuropathy, we found this session to be very helpful and educative, and we're really appreciative of your time as well. In closing, I wanted to thank all of you for joining us today and watching this session. I hope you also found it to be fruitful. A recording will be uploaded onto our website shortly, hopefully within the next few days, so stay tuned. If you liked it and you like what we're doing here at the Foundation with respect to patient education, I would love to ask you to become a donor or continue donating to us. Every dollar really matters, and we're so very appreciative of your support. And as always, if you ever need anything, you can reach us through phone or email. You can also mail us inquiries. The information is currently up on the screen right now with all of our contact information here at the Foundation for Peripheral Neuropathy. And on behalf of myself, Lindsay Colbert, and my colleague Tanya Zivin, and Dr. Patterson from Mount Sinai, we thank you all for joining us, and this concludes today's session. Enjoy the rest of your day, and please stay safe out there. Bye, everyone.